I'm Melanie Griffith, President and CEO of the Maryland Hospital Association. On behalf of MHA, thank you to the Daily Record for hosting this special event and for shining a spotlight on the remarkable individuals who make a difference in healthcare every day. We're proud to serve as a partner in recognizing Maryland's healthcare heroes. Today, we celebrate you, the caregivers, clinicians, leaders, and so many others whose work touches the lives across our state. Across Maryland, hospitals and health systems see extraordinary examples of compassion and dedication. We see people who answer the call during some of the most important moments in a person's life. Healthcare requires skill and heart, and every day, Maryland's healthcare workforce delivers that to their patients, families, and communities. To all of today's honorees, congratulations on this well-deserved recognition. Your contributions strengthen our healthcare system and improve the lives of countless Marylanders. At MHA, we're proud to stand alongside you in this shared mission of care. Thank you all for all you do, and thank you for caring for Maryland. Care takes all of us.
Lisa turned a personal conviction that caring for caregivers is the ultimate form of patient care into a lifelong mission. At GBMC's height of the COVID-19 pandemic, she simultaneously managed a healthcare crisis and launched a new mother-baby care model, conducting one-on-one interviews with her entire team to address individual needs. Named one of GBMC's 60 most visionary women in 2025, she led the efforts that earned GBMC the National Baldrige Award in 2020.
Looking back, I think co-leading our organizational journey to receiving the Baldrige National Quality Award is one of my proudest professional accomplishments, particularly as we achieved this in 2020, while we were simultaneously navigating the COVID pandemic. I think one of the reasons this comes to mind for me is while this milestone was a system-wide recognition, more importantly, it deeply reinforced my core belief that meaningful accomplishments are never singular. Over the years, I've learned that the impact of even the greatest leader will be greatly diminished without committed expert teams. I consider it a great accomplishment to have been able to surround myself with brilliant individuals, each with their own strengths and contributions, so that for me, every success or accomplishment is measured by what we achieve as a collective team. While the Baldrige recognition was a significant milestone for our organization, what I saw as an even greater accomplishment was watching our system-wide interdisciplinary teams break down historic silos to achieve it. Anchoring our work in our purpose and our organizational mission, vision, and values is our strategic compass to guide us in all accomplishments so that we never lose sight of why we do what we do.
Congratulations, Lisa! Elias has built a psychiatric career rooted in trust, earning recognition as a top psychiatrist in Baltimore Magazine for 12 consecutive years. Honored with the American Psychiatric Association's Distinguished Fellowship Award and NAMI's Exemplary Psychiatrist Award, he has worked tirelessly to expand access to behavioral health care, dismantle stigma around substance use disorders, and mentor the next generation of physicians.
As a psychiatrist, our greatest challenge continues to be the stigma of mental illness. Stigma is not just an abstract concept of understanding that diseases that hurt our emotions, thoughts, or behavior are just like ones that hurt our heart and stomach. Instead, years of stigma have translated into a structure of discrimination. Discrimination in our language, discrimination in our health insurance, disability insurance, government agencies, employers, and our legal system. We have made great progress We have overcome many barriers, but dismantling the discriminatory structure that has been built over the years is an ongoing endeavor and requires much more to be done. In my daily work at MedStar and as the current president of the board of directors of the Maryland Foundation for Psychiatry, our primary mission is to raise awareness about mental illness, improve access to care, and continue to fight stigma and its complications.
Congratulations, Elias. A certified falls prevention specialist, Zeeshan has transformed how Maryland addresses senior safety by turning academic research into real clinical tools. He founded and chairs a multi-region falls committee, trains clinicians in safety practices, and shapes national guidelines, all with a singular mission: shifting senior care from reactive treatment to proactive prevention. Congratulations, Zeeshan.
Joseph meets teens exactly where they are, in schools, after school, and in the moments that matter most to them. He leads The Clubhouse by Ashley, a free program for teens affected by substance use disorder, and The Roots Project, a peer-led school-based mental health initiative. His willingness to share his own lived experience helps young people feel seen, heard, and hopeful. Congratulations, Joseph.
Phyllis believes true healthcare reaches far beyond the clinic walls. As Assistant Vice President of Care Transformation, she advances total person care, connecting individuals to food, housing, behavioral health support, and community resources. Her work is culturally responsive, community-centered, and built on trusted relationships that bridge the gap between healthcare systems and the people they serve. Congratulations, Phyllis.
For more than a decade, Tawanda has connected Baltimore patients and families with vital healthcare resources through compassion, education, and trust. She goes beyond her role as a certified medical assistant, meeting people where they are and making healthcare accessible for all. Her relationship-driven outreach has strengthened community ties and empowered residents to take control of their health. Congratulations, Tawanda!
Mary meets people where they are and then builds programs around what they need. She created the Food is Medicine program, delivering fresh produce to food-insecure patients with chronic disease, and the Baby Closet, which has provided essential supplies to over 450 families. Her proactive approach addresses social barriers before they become health crises. Congratulations, Mary.
Saray knows that behind every statistic is a mother doing her best. She created a baby pantry within her OBGYN practice, giving mothers diapers, formula, and essential newborn supplies during routine visits, right where they already feel safe. The result is deeper trust. Patients now speak openly about hardship, knowing they will never face judgment. Congratulations, Saray!
When Rachel joined Ascension St. Agnes in 2024, she rebuilt a paused maternal health program from the ground up. She co-founded the St. Agnes Baby Closet, organized community events serving hundreds of mothers, and helped drive anemia rates in pregnant patients to an all-time low. Since 2025, not one of her program's patients has appeared on the hospital's severe outcomes list. Congratulations, Rachel!
Jamie has spent 2 decades ensuring that people with disabilities have a voice in designing the systems that support them. She launched the state's first truly inclusive summer camp, advocates before Maryland's legislature, and helps coordinate services for over 12,000 people with intellectual and developmental disabilities. During the 2025 legislative session, her work helped restore critical Developmental Disabilities Administration funding. Congratulations, Jamie!
Heather has spent a decade at MedStar Health normalizing mental health care for healthcare workers. Leading a team of coaches embedded across Maryland and DC, she built programs using the Stress First Aid framework and anonymous suicide prevention screening, logging over 10,000 associate touchpoints last year. One resident she coached credited her support with saving her life. Congratulations, Heather!
Over 35 years, Cindy has built mental health programs from the ground up. From developing a pediatric inpatient psychiatric unit at Children's National to designing emergency mental health spaces and comprehensive behavioral health campuses. A NAMI board member, nursing educator, and community advocate, she championed mental health awareness before it was widely embraced. Congratulations, Cindy!
Known as Tinu, a Tinuke is a nurse executive who leads from the front, rounding with patients, stepping in to feed or bathe them when needed, and building a culture where staff feel heard. She transformed one unit's 80% staff turnover rate down to just 17% through scheduling reforms and team building initiatives. Congratulations, Tinuke!
As Director of Nursing for the ICU, Sydney championed a nurse-driven awakening and breathing protocol to help patients get off mechanical ventilation faster. She set a goal of 15% improvement in compliance and achieved 41%, doubling the unit's overall rate. Her greatest pride is the mentorship legacy she leaves behind. Congratulations, Sydney!
Bonita leads Anne Arundel County's only adult and pediatric forensic nurse examiner program, providing round-the-clock care to nearly 300 patients annually, survivors of sexual assault, domestic violence, child abuse, and human trafficking. Her advocacy doesn't stop at the bedside. She develops workplace resources for colleagues experiencing intimate partner violence. Congratulations, Bonita!
Inspired by her mother's compassionate example, Maria has spent 2 decades pouring that same spirit into her patients and colleagues. During a routine bedside handoff, her sharp instincts caught a patient bleeding heavily after wound debridement. Her quick action prevented a potentially catastrophic hemorrhage. Outside the hospital, her nonprofit ships hurricane relief and funds pharmacy students abroad. Congratulations, Maria!
Jennifer founded her unit's first nursing shared governance quality council, built a real-time quality dashboard, and redesigned emergency supply kits for tracheostomy patients, all to make care safer and give frontline nurses a real voice. Outside of work, she says raising her 2 children, Owen and Eliza, is her greatest accomplishment. Congratulations, Jennifer!
Maryland takes maternal health care into the homes of high-risk mothers across Maryland, delivering clinical care, mental health screening, and crisis intervention where it's needed most. When one patient showed signs of preeclampsia and postpartum depression at home, she initiated emergency protocols, arranged readmission, and coordinated childcare, all before a life-threatening situation unfolded. Congratulations, Marilyn!
When Ashley publicly called attention to a critical shortage of COVID-19 tests in Cumberland in 2020,
her employer fired her. Instead of abandoning her patients, she opened her own practice, finding a building, renovating it, credentialing with insurers, and seeing patients within 3 months. Most of her patients followed her. Congratulations, Ashley.
For 16 years, Mary Rose has worked the overnight shift as a surgical PA at Northwest Hospital, managing everything from orthopedics to neurosurgery, while the rest of the world sleeps. Her clinical judgment rivals that of seasoned residents, and her compassion shines brightest in the hardest moments, guiding patients and families through end-of-life decisions with extraordinary care. Congratulations, Mary Rose.
As Director of Neonatology at GBMC, Dr. Aucott transformed the NICU by championing skin-to-skin contact for premature babies in their first 24 hours, raising the rate from 50% to over 90%. A mentor to a generation of neonatologists now leading across the Baltimore-Washington region, she has spent 4 decades making the smallest patients feel the biggest impact. Congratulations, Dr. Aucott.
Dr. Bennett is a cancer surgeon and innovator who leads LifeBridge Health's entire surgical division while still operating on some of the most complex tumors imaginable: pancreatic, liver, sarcoma, and beyond. He earned his MD summa cum laude, trained at Memorial Sloan Kettering, and added an MBA to prove that community hospitals can deliver world-class, cutting-edge care. Congratulations, Dr. Bennett.
Board certified in both family and addiction medicine, Dr. Chamberlain serves Baltimore's most vulnerable patients at a federally qualified health center, leading HIV, hepatitis C, and PrEP programs while achieving a 100% linkage to care rate for every patient diagnosed with HIV. When a patient in crisis needed her most, she stayed for 2 hours until that patient left with hope. Congratulations, Dr. Chamberlain.
Dr. Crowder cares for Mount Washington Pediatric Hospital's most fragile newborns as a neonatologist, and in 2025, she stepped into a groundbreaking new executive role, the hospital's inaugural Health Impact and Engagement Officer. From the bedside to the boardroom, she is closing gaps in care and building a healthier future for children across the Baltimore community. Congratulations, Dr. Crowder.
A nationally recognized pediatric gastroenterologist with over 40 years of leadership, Dr. Zinn kept the University of Maryland Golisano Children's Hospital open every single day through the COVID-19 pandemic, even after losing his own mother to the virus. He and his team never closed their doors because the children of Maryland needed them. Congratulations, Dr. Zinn.
Dr. Demidowich is reimagining diabetes care from the inside out at Johns Hopkins Howard County Medical Center, creating a Diabetes Champion Academy for nurses, a hospital CGM discharge program, and system-wide EHR improvements that reduce dangerous complications. His relentless focus on building care systems that are simple, excellent, and reproducible is changing outcomes for patients every day. Congratulations, Dr. Demidowich.
As System Chair of Women's and Children's Services at Luminous Health, Dr. Jones led a perinatal quality initiative that actually reduced cesarean and preterm births during the COVID pandemic. She then championed a brand new birthing center coming to Prince George's County in 2028 because too many women there are currently leaving their county just to have a baby. Congratulations, Dr. Jones.
Dr. Levy built Maryland's first ground-based pre-hospital blood transfusion program from the ground up, developing protocols, training paramedics, and saving lives faster than ever before. Now adopted by more than a third of Maryland EMS systems, his work is the reason more people survive severe bleeding emergencies before they ever reach a hospital. Congratulations, Dr. Levy.
When Dr. Patel launched Calvert Health's orthopedic surgery program in February 2025, he made one thing clear: every patient would be seen, regardless of insurance. Within 4 weeks, the practice was treating the full spectrum of orthopedic conditions, and within 9 months, he was already transforming operating room efficiency as chairman of perioperative governance. Oh, And he's also a certified yoga instructor. Congratulations, Dr. Patel.
From rebuilding a burnout-ravaged psychiatry department to designing an advanced care-at-home program that kept thousands of patients out of the hospital during COVID, Dr. Sabi transforms entire healthcare systems. A Navy veteran and passionate advocate for culturally competent care for veterans, she leads with equal parts discipline, vision, and heart. Congratulations, Dr. Sabi.
Dr. Sarkeesian made history as the first physician in the country certified to prescribe tumor-treating fields to pancreatic cancer patients, one of the most difficult cancers to treat. Working at Frederick Health's James Stockman Cancer Institute, he has made it possible for patients to receive advanced cancer care close to home. Outside medicine, he is a professional classical violinist. Congratulations, Dr. Sarkeesian.
Dr. Thomas saw that nearly 10% of patients in her emergency department were leaving without being seen, and she fixed it. Within 3 months of becoming chair, she designed a rapid turnover care model that cut that rate to under 2% and has since been adopted at 8 hospitals, giving more than 2,000 additional patients each year access to emergency care. Congratulations, Dr. Thomas.
Born with a seizure disorder that once limited her path, Christina turned personal resilience into decades of service. A former medical technician and daughter of a Korean War nurse, she has volunteered since 2011, staffing nursing stations, welcoming patients at the front desk, and returning without hesitation after COVID. Her motivation is simple: giving back what was once given to her. Congratulations, Christina.
Susan spent decades shaping young lives as a special education teacher before channeling that same compassion into more than 10,000 hours of volunteer service at Northwest Hospital. From patient advocacy to flu clinics, she has done it all. But her proudest accomplishment is simply making patients and families feel comfortable during their most difficult moments, whether through a kind word, a smile, or a cup of coffee. Congratulations, Susan. Founded in 2023 with a bold mission to elevate care for the Medicaid population, Achieve Behavioral Health Services has already served more than 1,325 clients, achieving a 73% program completion rate against a national average of 42%. Their secret? Staff members who are in recovery themselves, including 12 program alumni, creating a culture of genuine understanding and peer-driven support. Congratulations, Achieve Behavioral Health Services.
Baltimore Medical System transformed prenatal and parenting care by replacing brief clinical appointments with a powerful group model. One that weaves medical assessments, health education, and peer connection into every session. For families facing barriers like social isolation and limited health literacy, centering pregnancy and centering parenting have become a lifeline, building trust and community while improving outcomes at every stage. Congratulations, Baltimore Medical System!
Frederick Health is catching lung cancer earlier and treating it more precisely than ever through robotic-assisted biopsy, 3D imaging, and minimally invasive techniques that reduce recovery time and risk. Recognized as a center of excellence for lung cancer care, the organization has increased early-stage diagnoses while serving as a regional training site, extending its impact well beyond its own patient population. Congratulations, Frederick Health!
Since 2020, Kaiser Permanente's robotic surgery program has delivered advanced robotic procedures to more than 1,500 patients in an outpatient setting. By bringing high-definition 3D surgical technology outside traditional hospital walls, patients experience fewer complications, shorter recovery times, and the ability to go home the same day. This pioneering model is making sophisticated surgical care more accessible than ever. Congratulations, Kaiser Permanente!
Marathon Health has reimagined what primary care looks like for working families and public employees, integrating medical care, behavioral health, and health coaching under one roof, with same-day or next-day appointments and providers who have real time to listen. The result is measurably better outcomes, high patient satisfaction, and a model that treats the whole person instead of isolated problems. Congratulations, Marathon Health.
Nurses at MedStar Franklin Square's Mother Baby Unit didn't just teach safe sleep, they made it a living standard of care. By embedding safe sleep education into every moment of a family's hospital stay, rather than saving it for discharge, the unit achieved something remarkable. Since implementation, Baltimore County has reported 0 sleep-related infant deaths. That's not a metric, that's lives saved. Congratulations, MedStar Franklin Square Medical Center.
For 6 decades, the Rehabilitation Institute at Sinai has transformed lives, helping patients reclaim independence after injury, illness, and surgery. Today, it trains more than 100 students annually, drives cutting-edge research in 3D printing and motion analysis, and shapes national rehabilitation policy. From the bedside to the research lab to the halls of advocacy, its commitment is singular: help every patient return to the life they love. Congratulations, Sinai Hospital of Baltimore.
PAVE, Pathways to Advocacy Against Violence Every Day, delivers trauma-informed case management to families impacted by homicide across Maryland. Case managers reach families within 48 to 72 hours of referral, providing mental health support, resource coordination, and financial assistance. The program has supported hundreds of children and families in Baltimore City and has emerged as a vital force in breaking the cycle of violence. Congratulations, Center for Hope.
When the ambulance leaves, this program makes sure the story doesn't end there. Fire and rescue clinicians visit homes, review medications, and connect high-need residents to healthcare, food assistance, and behavioral health resources. The results are striking. Within 6 months, enrolled clients saw 911 calls drop 64%, emergency department visits fall 63%, and hospital admissions decrease 56%. Congratulations, Howard County Department of Fire and Rescue Services.
MAX has become Maryland's backbone for addiction medicine support, and it's entirely free to clinicians. Through a real-time consultation warm line, live trainings, and hands-on technical assistance, MAX brings specialized addiction expertise to providers across every corner of the state. Since 2023, Maryland has seen a nearly 50% decline in fatal overdoses, a milestone MAX has helped make possible. Congratulations, Maryland Addiction Consultation Service.
University of Maryland Baltimore Washington Medical Center's Prevention with Intention is a faith-based chronic disease program that brings free health education and screenings directly into Black communities through local churches. The program is creating a positive impact on the health of the community. In August 2025, 75% of program participants were diagnosed with high blood pressure at the first screening. By the end of the program, those numbers had significantly improved. 51% of participants saw a reduction in their blood pressure. 35% had reduced their A1C levels. 67% had lost weight, and 63% had decreased their body mass index, BMI. Congratulations, University of Maryland Baltimore Washington Medical Center.
When there's nowhere else for children in psychiatric crisis to go, GBMC's emergency department team steps in, sometimes for months. With no inpatient psychiatric care on site, staff use their own money for birthday gifts, holiday meals, and clothing, keeping vulnerable kids safe and cared for while a broken system searches for placement.
Congratulations, Greater Baltimore Medical Center.
NCIA serves Maryland's most complex and underserved individuals, people with intellectual and developmental disabilities who also face serious mental health needs. Having supported over 25,000 people, NCIA recently earned the highest national accreditation from the National Association for the Dually Diagnosed, one of only 3 Maryland providers to achieve that distinction. Congratulations, NCIA!
In just 1 year, Shepherd Pratt opened new residential crisis and long-term treatment programs in Baltimore City, launched a 41-bed apartment-style recovery program in Towson, and broke ground on a new residential crisis facility in Howard County, adding critical alternatives to emergency departments and helping more Marylanders access life-changing mental health care. Congratulations, Shepherd Pratt!
University of Maryland, Baltimore Washington Medical Center's behavioral health team, nurses, physicians, social workers, and more goes far beyond the hospital walls. From staffing NAMI Walk resource tables to facilitating county behavioral health summits and joining Governor Moore for the signing of landmark mental health legislation, this team champions access and compassion across Maryland every day. Congratulations, University of Maryland, Baltimore Washington Medical Center.
The Baltimore Medical System Wellness Program takes healthcare beyond the clinic, tackling diabetes, hypertension, housing, nutrition, and mental health for the region's most underserved communities. A multidisciplinary team of physicians, nurses, social workers, and community health workers delivers coordinated, holistic care that reduces hospitalizations and breaks down barriers. Their integrated model doesn't just treat illness, it builds lasting community trust and health equity. Congratulations, Baltimore Medical System Wellness Program!